propofol, 2007, 2008. It was shortly after I agreed at the beginning of 2009 to go to England. Michael comes to Las Vegas. That's the very first time he had mentioned to me if I had propofol. And as I stated in my book, and more details, this is it. I could not give him propofol.
Dr. Murray, most doctors, I'll put myself in this category,
Sure.
would drop a patient if they insisted on taking a drug that I thought might be dangerous for them. I would feel used if I was put in that situation. Did you feel like that?
I met Michael Jackson when he asked, at that time when he asked for the propofol. It was something that he was using since the 1980s.
From the 1980s?
He said in the late 80s on his tour, he would use propofol in Germany and other places, and doctors traveled with him who gave him the medication. And I said, it's not good for you. I don't think you should use that. I did not agree with Michael that he should use propofol. Then when he brought out his own supply in his red and white sports bag, doctor, the bag could not even be zipped up. It was loaded with propofol, his own stash, in his home. I did not want Michael Jackson to be using such a substance, especially feeling that he was invincible and it had no danger as far as his expertise and experience with that drug.
Then why did you keep treating him? You're telling me that he was calling you to get the drugs, and yet he had the propofol in a bag filled so high he couldn't close it. He didn't need you to be his doctor. He was getting it by himself.
He was. Doctor, if you ask me, Dr. Murray, would you have done it differently? Had you had that opportunity? Now with the knowledge that I have? Absolutely. I would have run away from Michael Jackson had I known that Michael Jackson was an addict to another substance, Demerol. But he hid this knowledge from me. I was totally unaware of that. Michael Jackson was getting upwards of 975 milligrams of the dose, combined with midazolam, which is also known as Versed. That's what he was accustomed to.
So he was getting 10 times the usual Demerol dose with a Valium-like substance.
Yes.
And he was still able to walk around.
The last 60 days of his life, how many times do you think he received Demerol in those enormous quantities? 51 times, the evidence of the trial will tell you, in the last 60 days of his life.
Dr. Murray, you were taking care of him. You're his primary caregiver. How is it possible you would not know that?
Well, Dr. House, it's the same as you wouldn't. Do you think that every patient that comes to you give you the total truth?
No, but I'm not living with my patients. I'm not going to Las Vegas with my patients. I'm not hiring exotic dancers with my patients. I'm not spending all my time with an individual. I probably would have noticed something.
Michael Jackson hid from me that addiction. Was it my fault that he did that? Possibly could have been, because I am totally averse to drug addiction.
All right, take a short break. We'll be right back. Next.